Hi, my name is Ruby.
Hi, my name is Squirrel! Nolan. ADHD stands for Attention Deficit Hyperactive Disorder, and it affects 8% of youths between the ages of 4 and 17 years old. It is diagnosed with 5 different factors. 1, the symptoms have to persist for at least 6 months prior to diagnosis. It has to affect somebody in multiple locations, as in school and home. It has to clearly impair life and normal functioning. And some symptoms have to happen before the age of 7. And there is a list of 18 different symptoms from the American Psychiatric Association. And they have to deal with 9 different symptoms of inattention, 6 of hyperactivity, and 3 of impulsiveness. And if enough of those symptoms, if all of these criteria are met, then a diagnosis can be made. There are 3 different types of ADHD. There's ADHD combined, which has a variety of different symptoms, while there's also predominantly attentive ADHD, where many of the symptoms are just that the child cannot pay attention. While on the other side, there's predominantly hyperactive impulsive, where most of the symptoms lie on that side of the spectrum.
One reason that the diagnosis of ADHD has been criticized is that many children can display behavioral characteristics of inattention and hyperactivity. For example, preschoolers, it is rare that they are not easily distracted by things around them, not impatient and challenged by having to wait their turn, and not describe appearance as on the go. The most common comorbid conditions contain symptoms that overlap with the criteria for ADHD. For example, difficulty sustaining attention may be a characteristic of stress, depression, or anxiety. Some studies have shown that for a significant number of children, an actual or suspected diagnosis of ADHD is disconfirmed after further assessment. An example of overdiagnosis, as described in one of the articles, talked about a boy who was initially believed to have ADHD because he was persistently inattentive even during a popular study unit on cowboys. Only after additional information was gathered did the origins of his problems become apparent. He was experiencing traumatic stress as a result of being sexually abused by men who had worn cowboy boots. Clearly, this child should not have been diagnosed with ADHD, and cases like this might be expected if ADHD were in fact overdiagnosed. Genetic studies show that ADHD is linked with being male. Girls with ADHD tend to exhibit lower levels of disruptive behavior and higher levels of inattentiveness, internalizing symptoms, and social impairment. As stated in one of the articles, it is true that a majority of children diagnosed with ADHD are being treated with medication. However, a rise in medication rates does not necessarily reflect overdiagnosis. Increased medication use may reflect increased awareness of the disorder, improved access to resources, or a legitimate rise in incidence.
In 1957, there was a study done by Laffer in which he was flashing kids with bright lights while he was injecting their arms with metronidazole in order to see if he could make their forearms flinch, as well as creating a spike in EEG. And it was through this study that it was suggested that kids who have ADHD have a lower threshold on what stimulus interests them and catches their attention. This study has never been repeated, though, due to the questionable ethics of it. It wasn't until the 1960s that the brain damage theory of ADHD fell away and it became known as a brain disorder, as well as the recognition of the attention deficit part of this. Prior to this, and still until the 1980s, people like to focus mostly on the hyperactive aspect of this. And from the 80s onward, the media became crazy with coverage of this because of all the kids that were taking pills more and more. And the Church of Scientology especially jumped on this media bandwagon and made it seem like a huge evil thing, so that within a few years, most of the American public felt very bad about all these stimulants and pills that kids were taking for the ADHD. In 2002, an international team of scientists came together and created an international definition of ADHD because it was being diagnosed differently throughout the world. And there's a big difference between North America and Europe especially. This declaration stated that there is undeniable scientific proof that ADHD is a real disorder, and that diagnosis must have evidence of a serious deficiency and or failure of a mechanism that's universal in humans that they should have at that certain age of their life. And there also has to be evidence that this problem is leading to harm of the individual, whether emotional or physical. It goes on to say in the same declaration from 2003 that studies indicate that less than half of those who have this disorder receive treatment throughout the world.
Okay, class, who wants to come up to the board?
Me!
Okay. What's 2 plus 2?
It's a doggy.
Show the class what 2 plus 2 is.
This is it.
Really? 2 plus 2.
But
Right, 2.
Hi.
2.
Hi.
Billy, 2.
No, I'm going over
What does 2
here.
look like? Billy?
Come in.
Oh my god. Okay, I have a problem with this kid. He's really hyper all the time, and I don't know what to do anymore. I think he has like a problem.
Well, don't worry about it. We will notify the parents, and then they can get a doctor's notification, and then they can give him these magical pills that will make him act better in school.
Yeah, I think he would really benefit from that.
Wonderful.
Yeah.
Come in.
Hey, how are you?
I'm good. How are you?
Good. I wanted to talk to you about a student who is really hyper. He won't focus when I try to teach him something. He's just all over the place. So I was wondering if we could like evaluate him for ADHD or something.
Well, yes, we can do that. We can also notify the parents, and then they can talk to a doctor, and then they'll be able to give him pills to make sure that he pays attention in class and he's not all over the place.
Yes, I think that will benefit him greatly because he's just not attentive at all during class.
All right then. Well, I will email the parents, and I will let you know when we get started.
Okay, thank you so
No
much.
problem. Have a good day.
Bye.
Our consensus is
That even though ADHD is underdiagnosed in some places,
in the majority of cases throughout the US, we believe it is overdiagnosed.